Typically the shoulder is a bit more forgiving than, for instance, the hip or the knee in terms of replacement, because you're not walking on it, so you've got two shoulders. A lot of people will put up with shoulder pain for a long time from arthritis, and the pain would typically come and go and be much more gradual than, for instance, a hip arthritis. But again, the main indication for shoulder replacement is pain. So function is always a little bit less easy to predict after replacement, particularly overhead function. So whilst you may have a very good result with pain relief, you may not always get good overhead function back after a shoulder replacement, and it's important to be clear about that beforehand. Typically a deep-seated pain in the shoulder, and again that pain can radiate down the arm, and also the side effects of the shoulder being immobile or not moving because of pain, or that muscles around the shoulder will tend to spasm, especially the trapezius, the periscapular muscles around the back of the shoulder, and also the muscles down the arm. Surgery is performed through an incision in the front of the shoulder, so what we call a deltopectoral approach. The implants are, as with any other replacement, they are modular. So this is a standard replacement here, which is replacing the ball and the socket. Again, the shoulder's got a big ball and a small socket, and metal implants with a plastic socket are very typical. There is a special implant that's been developed for people who have what's called a rotator cuff deficient shoulder. So if your rotator cuff is no longer there, the tendons around the shoulder are no longer there, the shoulder will tend to migrate upwards. And to prevent that migration, there has been a special implant developed called a reverse shoulder replacement. What that does is switch the ball and the socket round so that the shoulder is sitting back more in its natural position, which helps you to make use of your natural or your remaining muscles in order to restore function. Again, that's the results of a reverse shoulder replacement, not as good as a total shoulder replacement, but again, you wouldn't expect that because you don't have any tendons around the shoulder to move, so that's understandable. So after a shoulder replacement surgery, as with any replacement surgery, we do worry about infection. So it's very important that you let us know if you have any problems with your wound after surgery. There's about a 1 in 100 chance of infection after shoulder replacement surgery. Again, if the implants become infected, that can be disastrous, and we might need to take everything out and start from scratch again, which is big surgery. There is a higher rate of dislocation after shoulder replacement surgery because of the nature of the ball and socket joint. It's a very loose joint, and so there is a higher rate of dislocation after surgery. In terms of implant failure, typically the socket has a higher failure rate because it's a very small piece of bone that we're replacing, and whereas the stem has a very low failure rate. But again, you're looking at 85% good or excellent results at 10 years after surgery typically. Surgery normally involves 1 or 2 nights in hospital. You will be wearing a sling for the first few weeks after surgery, but there really are not a lot of restrictions after shoulder replacement surgery. I'll try and get you moving pretty quickly. I do tend to protect one tendon that externally rotates the arm, so there's no external rotation beyond neutral, which is about here, for 6 weeks after surgery. It is a painful operation. Most of the time these days we would do a block at the time of surgery so that you are pain-free when you wake up. That seems to make a big difference to your results in the short to medium term. You can expect improvement after shoulder replacement surgery for a year, so you will probably get some overhead function by 6 weeks. I would normally expect that it would take 6 weeks to be able to drive comfortably again. And in terms of getting good function in the shoulder, probably 3 to 4 months. There's not a lot of controversies really regarding shoulder replacement surgery. I guess the real controversy is when to do it, because often people can put up with it for a long time, and some people elect to have nothing done about it. The only problem with that is that your shoulder might erode further, and if you're not using the shoulder, the muscles will waste away very quickly, which does tend to make subsequent replacement very much more difficult. So I think if you're having pain, especially pain that wakes you up at night, then you should consider a shoulder replacement.